A clue as to how many of us have actually had the virus.
Around 17% of people in London and around 5% or higher in the rest of the country have tested positive for coronavirus antibodies.
Scotland plots a cautious route out of lockdown.
Let me stress now that the nature of what we are dealing with means that these proposals cannot be set in stone.
And why Sweden's property market suggests the UK's isn't heading for a swift recovery. This is Coronavirus, the latest from The Telegraph. I'm Theodora Louloudis. Around 5% of the UK and 17% of London have tested positive for coronavirus antibodies, according to a government study. They aim to tell you if you've ever had COVID-19. Mr Hancock confirmed they'd be made available to the public over the coming months, a move he said would help us learn more about the virus.
It's that knowing that you have these antibodies will help us to understand more in the future if you are at lower risk of catching coronavirus, of dying from coronavirus, and of transmitting coronavirus. History has shown that understanding an enemy is fundamental to defeating it.
Dr Al Edwards, Associate Professor in Biomedical Technology at the University of Reading, is one of many experts keen to stress the uncertainty surrounding antibodies.
We know that most people who have the infection and recover are very unlikely to get reinfected. But the tricky thing with antibody tests is that they don't guarantee that you're actually immune and safe from reinfection. So I'm aware that I'm sort of saying something contradictory there, but the overall message is, yes, the test means that you've probably had the infection. If you've had the infection, you're probably not going to catch it again, but it's no guarantee that you're safe.
And while the vast majority of those who've had the virus do make a full recovery, there's increasing concern about a small but significant number of patients whose symptoms persist weeks and even months after first falling ill. Georgina Hayes has the story.
At the heart of these strange times is a particularly strange disease. So unusual, in fact, that a leading King's College London scientist told me that it's one of the strangest he's ever come across. Professor Tim Spector, who's head of the team that developed the COVID symptom tracking app, told me that around 1 in 20 COVID patients are still experiencing symptoms after a month. And these symptoms aren't just coughing and a fever, they're headaches, fatigue, breathlessness and random pains. It's also looking like people with a very acute onset of the virus during the first 2 days tend to get it out of their system after about 10, whereas the patients who have more strange symptoms tend to have them for longer, in this sort of coming and going pattern. He's really concerned that we're underestimating the virus and that we aren't collecting the right data to understand the long-term consequences. Perhaps most worryingly, he told me they're now looking into whether people who have these long-term symptoms are still infectious, which could pose problems for easing the lockdown. The assumption at the moment is that you're infectious for around 1 to 2 weeks, but Professor Spector's worried that that may not be the case for everyone. Experts also told me there's concern around the rehabilitation services they can provide for recovering COVID patients, because social distancing means that much of this will have to be done online. That's obviously going to pose quite a challenge, not just in terms of making sure a patient isn't being pushed too far, but also for those who can't access technology or don't speak good English.
All 50 US states have now lifted some of their lockdown restrictions, with Connecticut becoming the final state to ease its measures. Italians can now sit in the piazza, the French can visit the coiffeur, and many Greeks are back on the country's beaches. And today, Scotland became the latest country to plot its route out of lockdown. On Thursday, Nicola Sturgeon announced a 4-stage lockdown exit plan, which won't see schools reopening until the start of the next academic year in August. Children will return to what she called a blended model with a mix of school and home learning. Scots will have to wait until at least July for offices and large shops to reopen, but people from different households will be able to meet up from next Thursday, provided it's in small groups and they stay 2 metres apart. The Scottish First Minister stressed the steps were conditional on the virus being kept under control, but expressed her willingness to ease the lockdown where possible.
The lockdown restrictions have been absolutely necessary to mitigate the massive harm caused by the COVID-19 virus. However, the lockdown is creating harms of its own: loneliness and social isolation, deepening inequalities and serious damage to our economy. None of us want it to last any longer than it has to.
Boris Johnson and Nicola Sturgeon had both expressed their interest in easing the lockdown in all parts of the UK at the same time. This hasn't happened, but the Telegraph's Scottish political editor Simon Johnson says there are parallels in the two leaders' approaches to lifting measures.
Now, in some respects, it's very similar to the three-stage plan that Boris Johnson unveiled for England 10 days ago and covers a lot of the same ground. But there are major differences. The Prime Minister's plan came into effect on May the 13th, but Ms Sturgeon will not even start implementing some of her Phase 1 measures for another week. At that point, gardening and recycling centres will start to reopen and people will at last be able to enjoy a game of golf. But much tougher restrictions will remain on car travel, with Scots not allowed to travel more than 5 miles from home. The schools will reopen up here on August the 11th, so maybe 2 months behind those in England, although that's partly explained by the different term times up here. The schools were due to go out on their summer holidays anyway at the end of June, so there's less benefit to them reopening in June only to have to shut again. Businesses have welcomed the route map but say they need far more detailed guidance on what's expected of them before they can reopen. And the tourism industry in particular has warned many firms are on the brink of collapse, with people booking staycations in Cornwall, which is seen to be open, whereas Scotland is staying shut for a longer period of time. So Miss Sturgeon's under a lot of pressure to help them.
The number of people infected with coronavirus around the world has reached the grim milestone of 5 million, with most new cases now coming from the US, Russia, Brazil and India. The World Health Organization confirmed on Thursday that a daily record of 106,000 new cases were recorded in the previous 24 hours, with 2/3 of them coming from those 4 countries. The figure's the highest in a single day since the outbreak erupted in the Chinese city of Wuhan in December last year. It came as the Director General of the WHO said the body was very concerned about rising cases in low and middle income countries. And the United Nations warned humanity's set to go into reverse for the first time on record because of the pandemic. The Telegraph's global health security correspondent Sarah Newey reports.
The UN has been measuring human development for 30 years. Though imperfect, this index attempts to take a broader look at human progress, taking into account health and education levels, as well as the economy. Every year since this index was introduced, we've seen a rise globally in real terms, meaning that our health, education and living standards have been improving. Even during significant shocks like the financial crisis, the overall index didn't drop. But according to an early simulation of the impact of the current pandemic, this period of progress is on track to suffer a steep and unprecedented decline. This is because the pandemic is having a triple hit on our lives. It's not just an economic crisis, but it's also having a direct and indirect impact on our health. Well over 300,000 people have died and access to care has been widely disrupted. And it's impacting our education. This last factor in particular is driving the predicted fall. Researchers estimate that 60% of school children globally are not currently receiving any education, a figure that rises to 80% in developing countries, where access to internet is low. And so the UN isn't just concerned that human development overall will be set back by the pandemic, but also that inequalities, both on a national and international level, will deepen. This research really paints a pretty stark picture of the impact of the pandemic.
The number of property sales in the UK in April plunged lower than the worst point of the financial crisis after the outbreak shut down the market. Last month, there were just 46,500 residential sales. That's less than half the number seen in the same month last year. Experts warn we're likely to see an even lower dip because deals completed in April were agreed before the housing market came to a complete halt for 7 weeks. As England's housing market restarts, it'll be sharply scrutinised for the effects of the lockdown. And the Telegraph's property correspondent Melissa Lawford says clues may lie in Sweden's property market.
Sweden's more relaxed attitude to coronavirus doesn't mean its property market isn't suffering. And as the UK begins to ease its lockdown, Sweden's property market can show us the future of our own. Until last week, there was a 7-week freeze on viewings and sales in England. Meanwhile, Sweden's property market was up and running. Even open houses are still allowed. When the outbreak began, Swedes rushed to get deals through, worried the country was about to go into lockdown. There was a surge, an echo of which is now happening in England's market, as buyers rushed to push through the sales that were suspended by the freeze. In Sweden, it didn't last. Now the economic effects of the pandemic are taking hold and the housing market is going into shock. Prices and transactions were stable until April, but this month they're falling. Agents are predicting price drops of 5 to 6%. This shows lockdown is not a big factor. The problem for the British market is not that it was suspended, but that it now has to face the things that really matter: the economy, unemployment, buying power, and consumer sentiment. The Swedish market is also insulated in a way that Britain's is not. One of the biggest risks for UK house prices is our private rental sector, which accounts for nearly a fifth of England's homes. Renters are the group most at risk of unemployment. If they can't pay their rent, landlords may be forced to sell up en masse at a discount. In Sweden, however, most rental properties are either managed by the state or large companies. They don't have the same risk exposure as us. The message? Our situation will be worse.
This is Coronavirus, the latest from The Telegraph. I'm Theodora Louloudis, and I'll have your next podcast on Friday evening. It'll be a bit of a different episode. I'll be taking you behind the scenes and shedding some light on how we cover coronavirus, the fresh challenges it's posed, the perils of working with data, and the logistics of doing it all from our kitchen tables. I'll be joined by two journalists front and centre of it all: Anne Gulland, deputy editor of our Global Health Security team, and Dominic Gilbert, one of our data journalists. If you're listening to this before Friday morning, send us your questions. I'll put instructions of how to do that in the show notes to this episode. And don't forget that you can subscribe to The Telegraph and access all of our journalism on health, politics, business, culture and more completely free for 30 days. Go to telegraph.co.uk/audio.